welcome back. We're a little bit ahead of schedule, but that's not a bad thing, I guess. My name is Kathy Bryant, and I am the Assistant Director for the Office of Community Outreach and Engagement. And again, just want to welcome all of you and thank you for joining us today. And thank you to all the amazing presenters that we've had this morning. So now we are getting to the part of the program that many of you have been waiting for. And it is my honor to introduce Dr. Betty Thompson, who will be presenting the Betty Thompson Awards today. For those of you who don't know Dr. Thompson, she is Professor Emeritus of the Cancer Prevention Program here at the Fred Hutch, and she's an internationally renowned community-based participatory researcher. She devoted more than 30 years of her research career here at the Hutch and the University of Washington to really work with community partners and stakeholders. And she partnered with community to develop interventions that were culturally relevant and really addressed the public health concerns that the community brought forth. Her expertise in health disparities and her commitment to increasing the presence of underrepresented students and fellows in the biomedical pipeline is also very well known. Dr. Thompson has been an inspiration and role model for so many of us, including myself, working towards social justice and medically underserved and disadvantaged populations. So thank you, Betty, for joining us today for the award ceremony. And before we jump into the awards, I wanted to tell you a little bit about the two awards that Betty will be presenting. The first award is the Cancer Health Equity Research Award. And this award is given annually to an outstanding scientist from the Fred Hutch University of Washington Cancer Consortium. And the award really looks to identify someone who has made significant contributions to cancer health equity. So in other words, this award really looks at recognizing scientists and carrying on the mantle of Dr. Thompson. And then the second award that will be presented is the Community Health Trailblazer Award. And this award is given annually to an individual or a group or an organization who has really had an extraordinary impact on the health and well-being of their community. So this award is given in recognition of their service and their dedication to health equity. This year we had a number of amazing nominations for both awards, but unfortunately we picked one for each. And now that you have some background on the awards and who they are named after, without further ado, I would like to turn the program over to Dr. Betty Thompson to announce this year's award recipient.
Good morning. Can you all hear me? I guess so. Okay. It's my pleasure to be here today. As Kathy said, I am now emeritus, so I don't work as hard as I worked before, but I still continue to do some work in health disparities. It's my pleasure to announce the recipients of these two awards this year. We have some outstanding candidates. And I'm going to start with the Betty Thompson Cancer Health Equity Researcher Award. This award goes to a person who is absolutely driven to do community good. He is a well-respected physician who also chooses to work with the community he serves. In other words, he is not simply in the office doing his medical duties. He is actually out in the community. As one of his nominators noted, he is a firm believer that community-based participatory research is the key to addressing prostate health outcomes, and he values community members and advocates as experts. Surely somebody who is following in the path that I think I laid out during all my work at the Fred Hutch. He is committed to reducing and eliminating prostate cancer in African American men while working with them. He goes out into the community to better understand how they feel about prostate cancer, how they think about it, and whether or not they will come in for screening. In addition to all of his focus on community work, He has received the Distinguished Researchers Grant from the Andy Hill Cancer Research Endowment. And this amazing award is funding his best practices research for better prostate cancer screening and diagnosis among Black men. He also has a Department of Defense award to create a cohort of Black men to learn more about the best practices for surgical treatments and outcomes to reduce disparities in prostate cancer. I can best summarize him by quoting from this letter. He is as brilliant as he is humble, and a perfect example of what work in cancer health equity and research should look like. Thus, it gives me great pleasure to present this award to Dr. Yao Niami. I think, Dr. Niami, we would like you to say a few words.
First, I'd like to start by thanking everyone for this recognition. It's an award that's following not only a tremendous legacy established by Dr. Thompson, but the previous winners have decades of experience doing really meaningful community engaged work. This award, I think, is really representative of a lot of people, wonderful mentors here in Seattle, Dr. Gore and Dr. Etzioni, Jay, Kathy, to name a few, and tremendous partnership with individuals like Dante Moorhead, Ben Young, and Victor Tolbert, Jenny Lee. And I say all of this just to highlight that this kind of work doesn't happen in isolation, and I proudly accept this award on behalf of everyone who's been mentioned. With things being so early in my career, it's hard to feel that I'm deserving of this award in some ways, and I will say that receiving this just gives me even more motivation to continue doing what I'm doing, to follow in the footsteps of Dr. Olinas, Dr. Dahl, and Dr. Ceballos, who are the previous winners, and I look forward to taking on that challenge. Thank you.
It's hard to applaud online, but thank you very much, Dr. Niami. I would like to move now to the second award, which is the Betty Thompson Community Health Trailblazer Award. This is a very personally important award to me because one of the things I learned in my many years of research is that people in the community are experts in so many ways, and so often they are given short shrift in terms of acknowledging how expert they are in terms of creating and developing avenues toward good health. So this award this year is particularly meaningful to me, and the awardee is an exceptional person who left her homeland in Mexico to come to the Yakima Valley in Washington State. And that is something that is very special to me because back in I'm trying to remember when it was, 1990s, I first began to do research in the Yakima Valley and became very familiar with the people in the valley and recognized the tremendous health disparities that existed in that region of the country. I worked in the valley for some 30 years and like to think that I did some good things there. And the person that we are awarding this to today is following in those footsteps tremendously. She was a physician in Mexico, and she has been an amazing force in addressing COVID-19 in the Yakima Health District, which, as most of you know, was extremely hard hit by the virus. Because she was herself a physician, She has become a trusted source of information for the Yakima Valley in terms of COVID-19. As an example, she led the training of 20 promotoras, lay health workers, to educate families about COVID-19 prevention, treatment, and vaccination. Amazingly, those promotoras reached over 4,000 families during the last quarter of 2020. She now continues her work by providing solid health information to the Spanish-speaking population of the Valley by hosting a bi-weekly radio show on Radio Cadena, or KDNA, which is the main radio station in the Valley. I would like to quote from her letter of nomination. Her presence is a tremendous gift to our community, where a complete dearth of information existed. Now resides a network of support and information sharing. She highlights perceptions or frustrations people have in seeking health care in the Yakima Valley, and she uses her expertise, both as someone who navigated those systems as an immigrant and as a trained physician, to bridge this gap. It is my great honor to give this award to Dr. Consuelo Rodriguez de Negrete. I hope I said that correctly. Thank you very much. And now you're welcome to say a few words.
Thank you. I am very happy to be here today. Thank you for this honor. I accept this recognition on behalf of the many organizations and people who have supported me in the Valley. Thank you, my co-workers at Pacific Northwest University, for the opportunity to work in research in the Yakima Valley. Thank you to La Casa Hogar for the opportunity to connect me with Latino community in the Yakima Valley. Thank you, my English teacher, co-worker, and friend Anna, because I am continue learning English. Thank you, Yakima Health District, for the support with campaign COVID-19 is real. Yakima Valley is excellent opportunity to work with my Latino people. Thank you all helping me with this, and I want to share this award with all of you. Thank you all. I invited you to continue with me as we look ahead, and the important work is still to be done. Thank you.
Thank you very much. We really appreciate our two awardees today for coming and joining us, well, for being at their homes, I guess, and joining us for this symposium. It's really great to see you two, and I really hope that as time goes on, you continue to do your work, as well as train others to do the same kind of work. And perhaps in the future, you could nominate somebody else to get this award. So thank you very, very much. Kathy, I'll turn it over to you.